reasons, because you can get the job done, and you're energetic and hungry to realize the change we need in the world. Because I'm not sure if you've noticed, but right now we have some pretty crazy men running the world. It might seem like a hard ask right now too, with funding cuts from the US, but it's not impossible. And now more than ever, we all need to be mobilizing our own countries to step up in filling these devastating gaps. Because if we don't, the prospects of ending the epidemics are really far away. So I think that's all I wanted to share with all of you. I wish you best of luck in this campaign. Anything I can do to help, I will be there, and I can't wait to see you being the impact in the world that we need.
Thank you so much, Robin. Such an energizing opening for us today. Really, really cool to hear about the incredible work that you were able to do in Canada for the previous replenishment. And thank you for sharing that sneaky, incredible statistic of the Global Fund saving more than 70 million lives. It's really, really incredible. So I'm going to bring us swiftly on to the next speaker. We have Brice Bambara, who's a graduate of the Graduate Institute of International and Development Studies with a master's degree in international relations and political science. He has a special interest in education, children, and health, and is currently working with the Global Fund as an associate specialist in the Civil Society Advocacy, Political and Civil Society Advocacy Department, External Relations and Community Division. Over to you, Brice.
Thank you very much, Ruby, and thank you to Robin for her intervention and pretty much for doing all the work for me, because now she's covered it all, and I'm going to try not to repeat most of the things that she said, but it's very appreciated. So good morning, good afternoon, and good evening to everyone joining us here today. It's an honor for me to be here, not just as a representative of the Global Fund, but as a young African myself, and also as someone who really believes in the power of young people to shape a healthier and more just world. So I know it's a delayed celebration, but we're celebrating August 12th, International Youth Day. And we're also here under the banner of the I Am the Impact campaign. And it's not just a slogan, it's a declaration. It's a declaration that young people are not just passive beneficiaries of global health efforts, but they are architects of change. They're change makers. They are the heartbeat of equity. So now, we have to be very clear. The Global Fund is currently doing its Eighth Replenishment campaign. And of course, that replenishment matters because it's going to help us get the funding that we need. But it also matters because youth matters, because young people matters. And, unfortunately, we still live in a world where 2 out of every 7 new HIV infections globally are among young people between the age of 15 and 24, and that's not okay. In 2019 alone, young people bore 57 of the world total communicable disease burden, with HIV, tuberculosis, and malaria being among the leading causes. And, I always say that when we give numbers, they're not just numbers. We're talking about individual lives, we're talking about dreams, we're talking about future. And it's always important to remind that. But, we see these numbers, they're scary, but, there's hope because we are here, because you are here, and because we know that, when young people lead, systems transform, they become stronger, there's changes, there's a revolution. And the I Am the Impact campaign is a reflection of this. At the Global Fund, we call it historical because it's historical, and it's a youth-led movement. It's youth-driven. It's youth-powered. It means that you guys are in the middle of this. You're at the center. You're telling us how we need to do things. You're telling us why the replenishment is important. You're also saying that to decision makers, and you're explaining to them why we need to get the resources that we need. And with this replenishment, as it's been mentioned many times over the past month, we're trying to raise money. We're trying to raise $18 billion through our replenishment. And this is to be able to save millions of lives, to prevent millions of new infections, and to reduce the mortality rate of these three diseases that I mentioned earlier by 63%. So it's not just an impact, it's a legacy, and it's something that is very personal. And I like always engaging in spaces like this because I've seen firsthand how when young people lead the advocacy, how policies can be shifted, how communities can be mobilized, and also how you manage to hold a decision maker and accountable, but also organization like myself. I've had the opportunity over the years to work along with young people that use their life, their lived experiences, and turn them into movement. Young people that refuse to just be numbers, to just be statistics, but to be part of the solution. And that is something that is very important, to remember, to remind, and I know that sometimes you sit there when you look at the state of the world today and you're like, oh my God, this is crap. Why are we even doing this? Why are we doing this? But you need to remember that you are part of the solution. And you need to remember that this replenishment is not just about the money, but it's also about hope. It's about faith. It's about faith in the power of young people. It's about faith in equity to make sure that everybody, regardless of where they are, where they came from, have access to the same quality of services. It's about faith in a future where no young people should die of diseases that are preventable. So it's something that is very important, and we have to fuel this movement. We have to amplify your voices, and we have to replenish not only the organization, but hope, because we are the impact. And as Robin mentioned earlier, from tomorrow, we will have updated numbers of what that impact that we've achieved together all look like. So stay tuned for that. And remember that the world needs us, needs you now more than ever. So I'm going to stop here, and I'm going to say thank you for all the work that you've already done and for all the work that you're going to keep on doing so that young people around the world have access to these services that they need and that is their right. Thank you very much.
Thank you very much, Brice. Really loved the sentiments around hope. And I think that really key message of replenishing not just the Global Fund, but hope itself is really powerful. I'm going to bring us swiftly over to Aman. So Aman Shukla is the lead and steering committee member at YOUNITE Global. Aman Shukla is a dedicated advocate for health equity, focusing on LGBTQ plus communities and key populations globally with expertise in TB and HIV. He is a board member of the Key and Vulnerable Populations Delegation to the Stop TB Partnership, who drives impactful initiatives. Aman also founded YOUNITE Global, who has invited us all here today, empowering young leaders to collaborate on eliminating tuberculosis. So over to you, Aman. Thank you so much.
Thank you so much, Ruby. So good morning, good afternoon, good evening, everyone. It is truly an honor to be here today representing YOUNITE Global and leading the I Am the Impact campaign. I want to begin by thanking our partners who have joined together to kickstart this webinar, fellow youth leaders, and every participant joining us across the world. Your presence shows that we are not just talking about change, we are living it. This webinar comes at a historic moment. We gather under the theme of empowering youth leadership for a resilient future, uniting HIV, TB, and malaria. It's not by chance that this is also aligned with International Youth Day 2025 and the Global Fund's Eighth Replenishment. These two movements converging to remind us of one truth. The fight to end HIV, TB, and malaria cannot be won without young people at the center. For too long, youth has been described only as the future. But I stand here today and say we are the present, we are the impact. Across the globe, young people are leading innovation in HIV prevention, ensuring communities know their rights and have the access services without stigma. Youth champions are fighting TB at the grassroots, challenging stigma and pushing for a nutrition, diagnostics, and treatment access. Young activists are working tirelessly for malaria elimination, from distributing nets to ensuring resources reach to most vulnerable communities. We are not just waiting for permission, we are already driving solution, But let's be very clear, none of this is possible without strong investment. The Global Fund Partnership has saved over 70 million lives, yet it works far from done. For millions of young people, especially those most marginalized, the Global Fund is not just mechanism, it's a lifeline. When we call for a fully funded eighth replenishment, we are not just asking for charity. We are demanding justice, equity, and survival. Because history will remember whether leaders and donors stood with us or abandoned us. As someone who has walked through this journey alongside trans, queer, and key and vulnerable population communities, I've seen both the pains of neglect and the power of solidarity. I have seen how access to treatment, mentorship, leadership opportunity transforms despair into hope. This is why I say with conviction, youth leadership is not optional, it's essential. Our campaign, I Am the Impact, is a movement of stories. It's a young people declaring that I am the impact when I demand access to treatment. I am the impact when I mobilize my community against stigma. I am the impact when I push for policies that includes us, not excludes us. This campaign is about raising our voice so loudly that no policymakers, no donors, no leaders can ignore us. Friends, this webinar is more than a webinar. It's a rallying cry to every donor, every government, every leader listening to us should invest in us, should trust in us, and should stand with us. To every young person here, know that your story matters, your leadership matters. Together, our collective power will shape a resilient future. Let us unite, not tomorrow, not someday, but today. Because we are not just leader for tomorrow, we are the impact for today. With this, I just want to be clear with the short messages and brief. Thank you so much. Back to you, Ruby.
Thank you so much, Aman. Really great to hear how you've packaged the campaign that we're working on into such beautiful, powerful words. Really key to that, I think, was about youth leadership not being optional, that it is essential, that the pain of neglect is evident, but also the power of solidarity is stronger. So moving us now to the exciting panel discussion. This will be hosted by Marianne Wambugu, who is from the Youth Pact and a key member of the Youth Replenishment Working Group, which we're in together. She will take us through a panel discussion Marianne is a youth advocate and a health leader from Kenya, serving as the adolescents and young people's representative on the Kenyan country coordination mechanism for the Global Fund. She is the executive director of Al Fajiri organization and global chair of the Pact, championing HIV, SRHR, mental health, and gender equality. So I'm handing the reins over to you, Marianne.
Thank you so much, Ruby, and thank you so much, Aman, for that speech. That was really profound. And thank you so much for even setting the pace for the panel discussion. So my role here is really simple because I have a quite panel of experts. When we say that young people are truly the leader of today, you will clearly see even from their bios and even from the discussions that we'll be having in a second. So my first speaker is Tanaka. Tanaka is a young person who has survived TB and has shown with integrity to be the leading in advocacy at provincial, national, and international levels. He has a disability, and he has shown the world that disability does not mean inability. He has held international, national, and provincial district posts in disability rights, inclusion, democracy, and participation of youth, advocacy, TB, SRHR, HIV, and AIDS. Tanaka was awarded an the doctorate degree by the University of London and World Health Organization for advocacy on ending child marriage and abuse. Mukua believes that advocacy skills are not only a fundamental part of a successful advocacy, but also building blocks of critical thinking and advocacy. He has also managed to win several awards at international levels, such as the Award of Excellence presented to him by the University of London. My next speaker would be Adeniji Ayodeji David. I am sorry if I mispronounce your name. I am still Kenyan. Yes, he's a community rights advocate, a sexual reproductive health rights advocate in Nigeria. David was the former association of positive youth living with HIV and AIDS in Nigeria, a national financial secretary. He's also the End Pediatric AIDS champion under the GNP Plus project. His love for his community made him the National Key Population Health and Rights Network coordinator. My next speaker will be Farida Sonia. She's a lawyer, she's a blogger and committed to promoting women and human rights initiatives, digital project manager and founding president of the, forgive me, I cannot be able to pronounce that word. It's quite heavy for me. My next speaker is Linda. Just a minute. Linda is a Cameroonian leader and expert in advocacy, resource mobilization, human rights, and SRHR with 9 years of experience in HIV and AIDS. She co-founded the Cameroonian Network of Adolescents and Young People Living with HIV and the West and Central African Network. Laura is a member of the Global Fund Youth Council and heads the Community Legal Clinic in the South region on the GC7. Our conversation will be centered around the realities of the Yankee population and even their challenges and the solutions. And even as we talk about challenges, it is important for people to clearly know that as young people, we experience challenges, but we are still central in figuring out our solutions. So my first question to all the panelists, which I'll give you in 1 minute, what does youth leadership in health mean to you? And how has it shaped your journey in HIV, TB, or malaria advocacy? I'll start with Tanaka. Over to you.
Okay, thank you so much, Marianne. Can you repeat the question?
The question is, what does youth leadership in health mean to you personally, and how has it shaped your journey in HIV, TB, and malaria advocacy?
Okay, thank you so much. Yes, it's clear now. the youth leadership in the health sector, to me it means advocacy and lobbying, especially on key determinants of health, that is TB, malaria, and HIV. And I, as a young person living with HIV, and also uh, a TB survivor, and also a malaria survivor also, I have first-hand experience in navigating the challenges of HIV, TB, and malaria. So to me, it means advocacy on doing issues that really affects young people. Those three diseases. So we are, to me, advocacy on a global stage. Also, not forgetting that we come from the local communities. So we starting from the local community up to the international level, for the leaders to know that young people are the real change. Thank you.
Oh, thank you so much for that response. David, what does youth leadership in health mean to you, and how has it shaped your journey in HIV, TB, and malaria? Thank you, Ndova.
All right. Thank you so very much, Marianne. Like my colleague have rightly said, it's advocacy, and youth leadership has really helped in the HIV response. There is a slogan that we use in Nigeria, that there is nothing for the youth without the youth. You cannot plan for the youth without the youth being on the board. You cannot just think for them. And let's look at the adolescent and young persons. You cannot just predict them. It takes who wears the shoes to know where it pinches, and it takes a youth to express a youth. You cannot just randomly think about for the youth. So it has really helped in the HIV system. It has really helped us develop a lot of guidelines and policies. It has really given us a voice. Before, they planned for us without us, but now they have gotten to understand that you cannot just do something for them without them being on the table. And now the youths have been brought into the leadership system, has taken them to being in the table where decisions are being made. It has helped in shaping a lot of policies and guidelines, knowing fully that these people has the right to so many things. And like I rightly said in my bio, that I am also once a leader in the system, and it has also helped us when we talk about retention to care, when we talk about adherence to care. It has shaped and helped us in so many ways. So I feel leadership, the youth leadership in the system has a long way to do, and it has a long thing to do. It has a long impact. Personally, I was built by a youth leader who is Aaron Sunday, Faith Onu. These are people that I look up to, and they helped in shaping me, and they helped in building my career. It helps you know where you belong. I can easily say that majority of the law that I know today had been by mentorship by a youth leader. It opens you to so many things that you don't know. It opens you to seeing so many things, and it makes you gain self-confidence. There is something in the HIV response we call peer-to-peer mentorship. Peer-to-peer mentorship has shaped a lot of lives, has shaped a lot of adolescent and young person, and it also makes them know that HIV, it is not a deadly disease. It does not stop your life. It makes you, and it shapes you the more. So to me, I think it's around bringing you to the reality of who you are. Thank you.
Wow. Thank you so much, David. And even when you mentioned about mentorship, I think then as young people, we need to put ourselves in a position where we can allow ourselves to be mentored, because it also takes an intentional person to be very intentional with you, and then for you to be even intentional in getting to learn on the youth leadership. Thank you so much. Amit, please mute Ahmed. Ahmed, please mute your mic. Okay. Thank you, Amit, for that. I would go to Farida on just the same question. Then Precious. Okay, thank you. Farida, then we can dive into other questions. So Farida, the same question. What does youth leadership in health mean to you? And how has it shaped your journey in HIV, TB, or malaria advocacy? Over. Go ahead, we can see you.
Thank you, Mariam, for the floor. Hello, everyone. It is a great honor for me to speak today. A very important subject, how to involve the community and in particular young people in the fight against malaria. For example, in my country, Burkina Faso, malaria is still the biggest cause of sickness and death. It stops children going to school, affects pregnant women, and reduce the progress of families and communities. Yet, young people represent more than 60% of the population in my country, Burkina Faso. It will be impossible to win this fight without young people. All days, I am posed the question, why is the community so important? Because no plan can be successful if people don't accept it. And young people are the key links between leaders and communities. We speak the local languages, we know the realities, and we have the creativity and energy to make a difference. As young people, we can take action in different of ways. Firstly, with creative such as music, dance, drama, or slam. These tools speak to the earth, help people understand, for example, how to use bed nets, get tested quickly, and get treatment. Second, through social media, we are all agree young people have the kings and queens of WhatsApp, TikTok, Facebook, Instagram, LinkedIn. We can use these spaces to share good information about malaria, fight bad information, and push our leaders to act. Third, through community actions like schools, clubs, youth association, helping to distribute bed nets, village, and removing stagnant water where mosquitoes grow. Some young innovators even create mobile apps, use drones, or make local repellents. All these actions are already demonstrating a clear message. Young people are already part of the solution, but we need to be more supported, included, and recognized in program and policies. I will finish with a message to all young people present in the call. Do not stay behind, be active. Even if you are not invited, take your place and show what you can do. Remember, we are heroes, and together we can reach zero malaria. And this eighth replenishment of the Global Fund is an excellent opportunity for you to prove what we are able to do by getting our leaders to contribute. Thank you.
Wow, thank you. Let's take a minute and throw in the love and the flowers to Farida. That was so profound. Thank you so much. I would go to Laura, and thank you so much. Thanks, Laura. Farida, please receive your flowers. Yes, Farida. No, not Farida. Laura Lonse. We have started the Eighth Replenishment, and even thank you so much, Farida, for even bringing in statements on the Eighth Replenishment, Laura. So, because we are entering the Eighth Replenishment for the Global Fund, why is it critical to invest in youth leadership, and what role does the youth constituency play in shaping priorities and accountability? Over to you. I hope I was clear. Please let me know if I should repeat the question.
Yeah, thank you for the question, and sorry for my voice. I have some issue with my voice. What I can say, why the leadership of youth is crucial, is because youth are, first of all, not just the beneficiaries, but they are change makers. You bring innovative ideas and fresh perspective. They are not just recipients of aid, they are active participants, driving change. Their involvement ensure that solutions are relevant and effective, addressing their specific needs and due to their generation. Secondly, when with the innovation and the energy of youth, they can influence political will and founding decision. So with their unique expertise, story, energy, uh, they can make political decision making to change. They can touch the how can we call them, the political the person having the power to decide to change the decision. I don't know if I can pass to French. So Miriam,
Really sorry, I have missed what you've said.
I don't know if I can pass in French.
Okay, that's possible. Guys, there's an option for translation. We can let Laura speak in French and then we do the translation, the English translation. Over to you, Laura.
Ok, thank you. Ce que je voulais dire, c'est ceci. Effectivement, le leadership des jeunes est crucial parce que les jeunes ne sont pas juste des bénéficiaires, ce sont des acteurs du nos expertises, nos histoires, notre énergie, nos réseaux peuvent influencer la volonté politique. Alors, nous, on prend l'exemple de la campagne Impact qui nous montre en réalité que les jeunes peuvent pousser, les jeunes peuvent pousser, les jeunes peuvent porter la voix de leur père, les jeunes peuvent provoquer le changement. Alors, ici, il est question de renforcer davantage le leadership de ces jeunes, non seulement même pas en leur faisant comprendre qu'ils ne sont pas capables, mais en les outillant de manière à ce qu'ils soient aptes à également porter ces causes jusque devant les personnes qui sont habilitées à prendre des décisions. Alors, Miriam, I don't know the next question.
You did. Thank you so much. Thank you so much, Laura. And allow me to go to Tanaka. Tanaka, I would really want to clearly understand how, what are the realities of the youth face on the ground and how can youth-led accountability make TV responses stronger? Because even as a young person who has survived TB, and especially from a key population angle, so what exactly are the lived realities of young people on the ground, and how can we ensure that there is youth accountability mechanism in the TB response? Thank you. Tanaka, I hope
Okay.
you're still in.
Yes,
Okay.
yes. Okay. Thank you so much, Maria. So, youth,
upgraded from
You were
the
right. Tuberculosis
restart
continue
in
to
different
affect young people, especially those in key populations, such as people living with HIV, migrants, people who uses drugs, and those in poverty-stricken or overcrowded settings. And then we have many youths who are lacking accurate knowledge about TB symptoms, transmission, and treatment, often mistaking it for pure men's disease or confusing it with HIV. And then we also have youth with TB often facing social exclusion, especially in schools or workplaces. And then this leads to delayed testing and treatment. And clinics may be unfriendly or judgmental towards the youth. And also this also goes in tandem with transport cost, long waiting times, and lack of confidentiality, which discourages many young people from seeking care. And then we also have a high co-infection with HIV, whereby in a high burden regions, TB is the leading killer of people living with HIV, especially young people and young women. Yet, integrated testing and treatment are often lacking in those high burden regions. So, we have also pure treatment adherence, long treatment durations, side effects also, and lack of follow-up support result in treatment dropout, fueling drug-resistant TB. Especially when I had TB myself, I had to take tablets which really disturbed my the color of my urine, and also that I had to be injected every day for 60 days, an injection every day. So this also caused me to have poor treatment adherence. But then I had to get encouragement from the healthcare service providers. And also now going to the question on how youth-led accountability can strengthen TB response. We can do this by training youths who can lead peer-to-peer TB awareness campaigns, and then they will be debunking myths and misconceptions on TB and promote early testing in schools, communities, and even online. And then youth also can document and report issues like drug stockouts, long wait times, and discrimination in healthy facilities. And then this will pressure systems to improve on the way they operate. And also that advocating for youth-friendly services, youth voices can push for TB testing and treatment sites that are youth-centered, integrated with sexual reproductive health rights, and accessible in informal areas. And then we also have go to youth networks, especially that we have YOUNITE Global. We can demand increased domestic funding and international funding for TB, such as the Global Fund Eighth Replenishment. Track how funds are used, and advocate for investments that addresses the real needs of the youth. And then my ending statement is, when empowered, youth are not just beneficiaries, they became change agents. Youth-led accountability injects agency, transparency, and innovation into TB responses, ensuring services are responsive, inclusive, and effective. Thank you so much.
Thank you. That was a very strong closing remarks. Thank you so much. Please continue sending the claps and the love to Tanaka. I'm remaining with only two speakers at the moment, and I would really love to introduce my very lovely friend called Linda Firi. Linda Firi is a young person from Malawi and also represents adolescents and young people in the country coordinating mechanism. So because Global Fund has been integral in ensuring that young people and even adolescent girls and young people's voice continue to be central in the grant investment in the country. So I really want to welcome Linda and also to even tell us how can we also make CCM spaces more inclusive and impactful for young people and also adolescent girls and young women. Over to you, Linda.
Thank you so much, Ruby. And thank you so much, Ruby, for the introduction. And thank you so much, everyone, for being here today. It's really, really Thank you so much, Mariam, for inviting me. So firstly, as a young person that is serving in the CCM in Malawi, I feel like the very first thing that we can do in order to make sure that we're creating a safe space, but also an inclusive space for the young people, is that we need to make sure that there is meaningful youth representation and not tokenism. Because many are the times whereby we just symbolically invite young people on the table, but then if let's say if it is at the decision making table, and then at the end of the day you find out that whatever you contributed is no longer in the outcome. So I feel like the what we can do in order to make sure that we're also including young people, we need to move away from just symbolically inviting young people on the table, but also instead we should make sure that young people are actively participating, but also their inputs are reflected in the final outcome. The next thing that we can also do is that I think one of the things that I've seen in my learn as the youth and HYW representative in Malawi is that there's still a problem whereby the them issue to say, if I'm not a key population and every problem that the key population are facing, it means it's not my problem because I'm not a key population. If I'm not suffering from TB, then that's not my problem. I'll be focusing on HIV because I'm suffering from HIV. So I feel like that is still a problem, and we need to work on that. If let's say a key population is facing this problem, it means that problem is not just for the key population. Because if they start, getting sick, it means it's not just them; the whole community gets sick. So we need to move away from looking at problems to say these are their problem, but our problem. So the other thing that I want to emphasize on is the capacity strengthening. Serving in the CCM, it's a very good thing because you represent all the young people. For example, I'm representing all the young people in my country and also all the adolescent girls and young women in my country. But then if you did not go for let's say mentorship, it means it's really hard for you to get used to the technical language, to the processes. But also at the end of the day, it's really hard for you to engage your community or your constituency actively. So maybe if we can just shift away from just doing the orientation, and then the rest you just leave it to the newly selected members of the CCM, but maybe conducting mentorship sessions over and over to keep on reminding them about the global fund processes, because you cannot just master them at once. To be honest, even you, Mariam, you can agree with me. For me, for example, when I was just selected to be the youth and HY, I really had a hard time, to interpret. They'll start mentioning about PR, but I don't know what PR is. Principal recipient. They'll start mentioning about the technical languages. You're new, you've never heard of CCM, but because you're making a difference in your community, you've been selected as the youth and HY, but you don't know. So proper mentorship is very important in as far as we want to engage young people, because if the representative is fully capacitated, it means that person is going to fully and meaningfully represent all the young people. But also another thing that I wanted to emphasize on, we need to make sure that we're creating a safe and supporting environment for a diverse group of young people. Because when we say young people, we're not just looking at the K population. We're looking at young people that are living with disability. We are looking at young people that are young women and adolescent girls and young women, all of them in their diversity. So one thing that I once noticed is that at the CCM, it's a very diverse group. You find out there are pastors, there are people who use drugs, there are K population, there are adolescent girls and young women. And then at the end of the day, you find out that in the meeting we are judging, we are discriminating others. So in order for us to meaningfully include young people, we need to make sure that we are also recognizing that young people are in their diversity, they are protected from discrimination, but also they're feeling safe in those decision making spaces. So the other thing that I would also like to emphasize on is that including young people, involving young people, also making sure that young people are meaningfully engaged starts at community level. we, in as far as we're talking about, making sure that we are recognizing them in that diversity. But then the very first thing that I feel like it is very important is for us to start, making sure that we are engaging young people from community level, doing community, consultations, community engagement with young people in their areas. So yeah, that's all. Thank you so much.
Wow. Linda, you've really hit the nail on the head, for sure, for sure. And I think we'll have more discussions on this, after this conversation, because clearly I really share your sentiments. And even as the young person representing, as the representative of young people in the CCM, for sure, hands up, you've done a good job in even articulating our issues. Thank you for that. My last speaker would be David. So as a young person living with HIV, David, what challenges do you still do young people still face in accessing treatment, care, and support? And how can young leaders influence change at the community and policy levels? Over to you.
All right. Thank you very much. I think you just heated me and gave me the easiest question, area of my specialization, and it makes it more easier for me. All right. So if I'm to mention challenges young persons are facing, I think it's going to be like a global thing. The first challenge is stigma. The second is discrimination, rejection for most key populations. Another is healthcare workers attitudes, and billboarding is also a huge challenge that we are not speaking about. A lot of adolescents and young persons have self-stigma. A lot is going through their heads and they don't know where to point to. And also there is another challenge that we are not looking at, and there is, the earlier the better, is mental health. And what would accumulate to all these things are rejections, stigma from the home, stigma from themselves, stigma from the community. And the country that I am is a country that is being shaped by culture and religion. Let me say African as a whole. Judgmental attitude from health workers and the likes, and low access to full care for the key population. And I'm going to mention it loud and clear on this call that it is becoming a wildfire ever since the stop work order from the PEFA. It has increased to the extent that the young key population does not even have access to their treatment as it should. Now they are being classified as a gen population, which makes it more stigmatizing, more discriminating, and traumatic. And how could young leaders, like you said, I think I'm on point, how could young leaders come to help? Now, I said something earlier about peer-to-peer navigation. We've been trying our best in building their character. We've been trying our best to build their confidence, but we still need to see how we could change so many policies. There's so many policies in Nigeria as we speak that are creating barriers and stigma on its own. We have anti-stigma and discrimination law, but I think the law are just there, but to hold people by the horns, its implementation is lacking. Nigeria is blessed with so many laws, but implementing those laws, holding them responsible is a problem. And we need to start speaking up as young leaders, fighting for each other. Like I said, I am a community rights advocate, and this is what we have been doing with the support from Global Fund to NEP1. We have been trying to see how to bring people to justice, but despite the fact all our fight and all our standing up, we still have so many people going through the stress of mental health, wellness. It deals with their mental health. They pull off immediately. They don't want to just. So we need to start advocating for policy reviews. We need to start looking into how we can bring our religious leaders, our policymakers to a round table and start speaking about these things. I remember vividly a state in Nigeria scrapped out their state agency for the control of AIDS because they didn't see the need for it. It is a wildfire. So we need to start making them understand that these programs, this and this, are what we need to shape and help these people out of their challenges. Do we have key population in Nigeria? We have a lot. But there are some policies that are making them be hidden, and it is now giving us tough time now to get them tested and to get them into care, also into retention. So we as young leaders need to start advocating, use our social medias a lot. I love when the former speaker spoke about social media usage. How do you use your social media? Let's spread the news. These people are on the social network. Let's start speaking about these things. Let's build our confidence. Let's build our courage. And yes, we'll get there. And before I end it, I will end it with, there is nothing for us without us. Thank you very much.
Thank you so much. Clearly, there's nothing for us without us. And even when you mentioned about policy, nowadays I am fond of saying that we need to think of the implementation plan before we develop any form of policy, because the gap is the implementation. So let's think about it first before now planning on developing of the policies and even guidelines in each and every country. And for sure, I really connect with what you're saying because it's also a common problem in our country, Kenya. So to all the participants, thank you so much. And even the panelists, thank you so much for those fruitful deliberations. And I'm hoping that from this, then we can forge our way forward, and even our call to actions, we'll be able to develop that and to ensure that as young people, we clearly have a direction on what exactly we are going to do in ending TB, HIV, and malaria. Thank you so much. Over to you, Ruby.
Thank you so much, Marianne, and thank you to, well, echoing Marianne's thanks to the panelists. You all did an incredible job, and it was really, really interesting to hear from your efforts locally and the challenges that you guys face. Seems like universal challenges and kind of universal solutions too. So it's lovely to hear from you. So I'm going to now just very briefly mention, and we are over time. So if anyone is able to stay with us, we really do appreciate that. We've got remaining a quick launch of the new Youth Impact Story Kit testimonial series, a call to action and some closing remarks. So we'll end it up as swiftly as possible, but I am going to pause now in case some people do have to leave us, to request that we all turn on our cameras if possible and take a quick picture. Aman, I think you were going to take the photo. So as many as possible, if you feel comfortable, turning on your cameras, giving a big smile, and Aman will work on taking a quick shot of all of us together. Will I count us down, Aman? Are you ready?
Yes, I'm ready. I will request Amit to kind of make it in a gallery form.
Yeah.
He forgets.
Let's not just do my face.
Yeah.
I think I can remove my own spotlight. So,
yeah.
okay, I've removed my spotlight.
Okay.
Now
Thanks,
everyone is
everyone.
in a gallery mode.
Yes,
Great.
thank you so much. Thank you.
So lovely to see all your faces. Okay, big smile. 3, 2, 1.
Okay, there's one more slide.
Okay, we'll make sure we get everyone in it. 3, 2, 1.
Okay, one more smile. 1,
Okay,
2.
3, 2, 1. Amazing. Okay, thank you so much, everyone. Lovely to see your faces. So I will now just briefly introduce. So we have, as part of this webinar, a launch moment for the Youth Impact Story Kit. So I'm not going to take up any more time other than stating that this testimonial series includes 10 young people sharing how the Global Fund has impacted their lives. I think there's a recording, a 2-minute recording, Aman, or
Yes.
we're going to just launch
May I
it?
present?
Yes.
Yes, of course. And this, these stories you will see dispersed on the social media of Unite and the partner organizations over the coming days. But we want to give you all a sneak peek now.
Okay, let me share my screen. Hope this is visible for all. My screen is visible for all?
Yes.
No, are you able to see the video?
No,
No.
No.
We're able
not
to
the
see your
video.
file.
Yeah, not the video, but the screen.
Okay, let me. I think there is some issue. Aman, if I'm sharing this to you and you can present, is it possible?
Sure.
Okay. I've shared you the video. You can present because in my screen there's some glitch. It only showing my screen only.
Okay, so I'm sharing my screen. Okay, can you confirm if the screen is visible?
Yes, it is visible.
Thank you. I'm really excited to see these 9 stories, sorry, to correct myself from saying 10 earlier, posted online. So keep an eye on the social media. Maybe if it hasn't been done already, you could share the social media pages in the chat, Aman or Amit, to make sure everyone is following and ready to see them.
Sure, we'll do that.
Amazing. Okay, so I'm going to now hand back over to Amit to give us some calls to action for mobilizing for this replenishment. A brief introduction about Amit. Amit Singh Gosain is a young and dynamic advocate from India, having rich experience of working in the HIV and TB landscape. He began his journey as a volunteer with a community-based organization working at the grassroots level, and has since grown into a strong voice for the HIV community. Amit has actively participated in several national-level HIV community consultations and policy dialogues, contributing to shaping inclusive responses. And currently, he serves as a member of the YOUNITE Global Steering Committee and leads the YOUNITE India country chapter. He's passionate about driving change, and he focuses on amplifying community voices through stories of resilience and transformation. His work reflects a deep commitment to improving the lives of affected communities while building strong collaborations with government bodies, institutions, donors, and bilateral agencies. Over to you, Amit.
Thank you so much, Ruby. Thank you so much, everyone, for being part of this lovely conversation today. We heard the powerful story. Sorry, we heard the powerful youth story, youth voices from across the globe that reminds us youth are not just a future; we are the present, driving change in HIV, TB, and malaria response. But now it's time for us to turn our word into action. The Global Fund Eighth Replenishment is a crucial movement. Without stronger youth voices and collective action, the progress we have made till date is at risk. Each of us has the power to make a difference. From this webinar, from this learning, what we can take ahead is sign and share the youth-led petition that we are driving, that we are trying, engage in the national and your country level consultation, try to make sure that youth voices are heard where the decisions are made. Like we are discussing that we should be presented at the decision making platform. Without us, there should be no policy. So that should be taken. Amplify our campaign and message. This I Am the Impact campaign is not my campaign. This is not only Unite campaign. This is our campaign. This don't limit this with us only. Take this campaign ahead at the global stages, at the global level, at the community level. Make sure that your voices should also come on the floor. Tag us using I Am the Impact, hashtag My Global Fund Story, and inspire others to stand with us to make this campaign as fruitful, as impactful that we are looking for. Together, we can show the world that investing in young leaders means investing in stronger health system, resilient communities, and healthier future for all. With this, I'm mentioning my last closing message that let's take this moment beyond this webinar because we are the impact, I'm the impact, you are the impact. Thank you so much.
Thank you so much, Amit. And you can see the remaining calls to action, or even more about the calls to action that Amit just explained, on the websites that have been shared in the chat. And I really liked how you ended it there with saying taking this moment beyond this webinar. I think that there's a lot of energy and excitement in this webinar. The hope that Brice was talking about earlier on, you can really feel it here. And it's important that we take this going forward now back to our communities. So with that, I'm going to hand back to Aman to give some closing remarks.
Yeah, thank you so much. So thank you so much, everyone, to every one who contributed to this webinar as a speaker, as an organizing committee. Special thanks to our members who are working tirelessly. Ruby, thank you so much for kind of beautifully, hosting this entire webinar. Every speaker, partner, young leaders who joined us today, your energy and commitment reminded us why this fight matters. This is not just the end of webinar, it is the beginning of a strong action. The Global Fund's 8th replenishment needs us, and the world needs our voices. Remember, we are not just leader of tomorrow, we are the impact of today. Together, we will end HIV, TB, and malaria. Thank you. Thank you so much.
Thank you. Thank you, everyone.
Thank you,
Have a lovely
Aman.
rest of your days. Bye.
Thank you very much.
Thank you very much.
Bye.
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 Thank you everyone for joining.
Amit, stay back. Huh?
Kindly connect, or maybe LinkedIn. Kindly share a LinkedIn on the chat box, please.
Bye-bye. Thank you.
Bye. Let me leave.
I think, Marianne, we can wait.
Yeah.